I'm Janae and I'll be performing wound care. I'll be your nurse for today. Before I do this, I want to make sure that I check my chart for my client, make sure I check my doctor's orders. I want to make sure that my client isn't allergic to anything. So I did all of that, washed my hands thoroughly, and now I'm going to approach my client. Hey, Mr. Jones, how are you feeling today? I'm Nurse Robbins, and I'll be taking care of your wound for today, so I'll be performing wound care. I want to make sure that you are indeed Mr. Jones, and you are. So awesome. I want to make sure that my bed is at an appropriate level to perform wound care. So right about in that area. I'm going to wash my hands. Put on me some nice clean gloves. And I'm going to provide privacy for my patient. And then, before doing so, I want to also let down my bed so that I can perform wound care. Did you need any medication before we get started? Okay, great. What's your pain level? Okay, 0, great. So we don't want to expose Mr. Jones, so we're gonna do this best way we can. I'm gonna take my pad and put it under Mr. Jones. Could you help me lift your leg a little bit? Okay. I'm gonna elevate his leg just a little bit. I'm gonna sit it down. This pad is to make sure that we don't make a mess. Okay. Take this off. Before I do that, I want to make sure that my bag is nearby so that I can put all my sore items inside my bag. We're going to take this off, and we're also going to take out the sore packing. Okay, I'm going to assess my wound. I'm going to make sure that we don't have any swelling, redness, or anything of that nature.
That you're gonna do that first. Gloves on. Open that.
I'm going to take off my gloves as well and put that in there. Going to put some sanitizer on.
Trash. Gloves in the trash. Hand sanitizer. So now you're.
Then I'm going to put on some new gloves.
Stuff out. Now you're dealing with this. So now we're gonna irrigate it, which means it's a syringe. You're gonna irrigate it, and we're gonna kind of catch it, catch the sap. I'll probably go in there in a second.
Okay. So what I want to do is I want to give you some saline. I'm going to pour me some in here.
You need to. Oh, here.
Okay. And then I don't have I use this as my picture.
You're gonna try it on outside.
And before I do that,
Trash inside the trash. Now that it's dry,
I'm going to measure my wound.
measure it.
We're going to do side by side from top to bottom. That's about 5 centimeters. Then I'm also going to measure from the side.
Then once it's measured,
That's about 2 centimeters. And then I'm going to measure the depth of
now
it.
you're dealing with
So that's about 1 centimeter. I'm going to trash this. And I'm also,
let it dry. Pack it with one.
well, I'm going to leave that right there until I get done rinsing out my patient.
Then you're gonna do this.
So I'm going to take some of this saline. I'm using this to catch anything. I'm going to rinse this out with my saline. While that drains, I'm catching that.
Gloves off.
I'm going to do it again to be on the safe side to make sure that it's thoroughly clean. That's doing that. I'm going to take me a pad.
If you're comfortable, do all your closing stuff.
Throw this in the trash. Trash it.
Is not allergic to anything that we're using. You're going to check his pain. After that, you're going to check his pain.
I'm going to
Okay, perfect.
clean the side with this trash it.
Okay. You can.
Take my second one and clean the other side.
Okay.
Trash it. And then I'm gonna take my last one and do down the middle. Yeah, I'm gonna trash it.
You know what? You do have to start there.
Before I get done with this, I'm going to just go ahead and get my tape ready
Hairdressing. And I already checked
so that I won't be struggling with tape
orders. We're doing what to draw.
while trying to do wound care.
My name is.
I'm gonna get you about 3 strips or 2 at least. I'm gonna use 2 for right now. If I need the other one, I will. Then I'm gonna take this right here and trash it. Lift your leg up for me, Mrs. Jones. Along with this pad here, we're gonna trash it as well. Along with my gloves. So that is in the trash. I'm gonna sanitize my hands. I'm gonna put on new gloves one more time.
So before you put gloves on, look back. Okay, well, guys, like there's a page. Okay, well, there's a swab on the outside. Look at you can wash your hands.
So,
And get my gloves
we
on.
got him all cleaned up. We got the area of his bed rather cleaned up. And then now I'm going to take me some gauze and I'm going to get them just a little wet. We want it a little wet, but not just too wet. So we're going to kind of squeeze this out. Then I want to kind of fluff it so that it's a little bit effective. You don't have to use so much of it if you kind of fluff it out. But you want to make sure that you're covering the wound so that it's properly getting cleansed. And by the way, I'm not dipping this in the same area. I use one side, I'm using the second side, and I would use
You're gonna change your gloves one more time before you get those out.
another solution for my third one.
Everybody else, y'all got till tomorrow at 6 to have this completed, okay?
Oh, nice.
Okay.
Because y'all all agreed here this morning.
Okay. So I have my wound covered up right there.
You know, we talked about
I didn't need a third one.
tomorrow evening at 6.
So I'm going to now take my pad and I want to make sure that Mr. Jones has this covered up all the way. I'm going to take my soap, Lord, I need soap. My tape, and I'm going to make sure that this is secure but not tight to the point where, you know, that wound's not getting any air.
Trash. Trash. Sanitizer. New gloves. Put sanitizer in his leg.
Okay. So this is secure. This is not too tight. I'm going to take my gloves off again. Wash my hands or sanitize, whichever one. I'm going to document. I'm going to put the date, which is 8/26/21. I'm going to put the time, and I would say that it's 300. Oh, I can't really see with my pen. And then I'm going to put my initials on that wound. Okay. Then I'm going to ask Mr. Jones, is there anything else that you need for today, Mr. Jones? I got you all nice and cleaned up. Did you need water? Did you want crackers? Okay, nothing? Okay. So I'm going to let you down at the normal height that you was at, so that someone else needs to come in here, or if you need to get up or go to the bathroom or whatever, now you're more than welcome to do so. I'm going to also cover you back up.
Yes, but you put new gloves on.
Make sure you're all nice and comfy. I'm gonna lift my bed rails back like they were. Anything else? Okay, no medications, no anything? Okay. So I'm going to let back my privacy because I'm done with my skill, and I'm also going to wash my hands. Skill complete.